We have a paradox in American healthcare. We have great science, excellent providers, but our delivery system is dysfunctional. On the science side, consider the incredible progress from genomics, stem cells, vaccines, medical devices, new drugs and imaging. I wrote about these in my book, The Future of Medicine, Megatrends in Healthcare. Yet most of us are frustrated that our doctor's hard to get to, that we have to wait, that we get little time in the office. The doctor's frustrated as well by all the regulations, the low reimbursement, the lack of time. And patient, employer, and government are all upset at the high and rising costs. We do not have a health care system. We have a medical care system or a sick care system. We deal with disease and pestilence rather than health in the broader sense. Sure, there are prevention efforts in public health, food safety, sanitation, lots of vaccines and screening tests. But these are rather limited compared to the efforts of disease management. The dollars spent are far and away for diagnosis and treatment, not health promotion nor disease prevention. Cost per capita in America is about twice that of the next most expensive developed country. And for all that money spent, our outcomes are no better. In fact, infant mortality is not as good as quite a few other countries, and our average lifespan is close to, but not equal, a number of other countries such as Japan. As patients, we're not the customer of the doctor or the insurer. Think about that. If we're employed, our employer is the customer of the insurance, but not us. You can prove this to yourself by calling the insurer with a question. See how long you wait on hold. We're not the doctor's customer either, because she or he gets most of her money or his money from the insurer, not from you. Perhaps you pay a small copay or deductible, but the insurer sets the fee and tells you and the doctor how much it will be. Now here are some other facts that show how just dysfunctional our system is. 100,000 patients die of preventable medical errors each year. It's been like that for decades, despite lots of efforts. To get a sense of how many people this is, consider that there are about 5,000 hospitals in the country. That means there are about 20 deaths per average hospital each year. Also, about 100,000 patients die of hospital-acquired infections each year. These two are preventable for the most part, yet we've not done so yet. We know how, but it takes time and it takes effort. It's not where we seem to put our priorities. Incentives in the system are not properly aligned, largely for financial reasons. For example, the physician needs to see more patients for shorter periods. The physician spends less time on preventive care, and the physician spends little time coordinating care for those with chronic illnesses. Very important. This all means less care quality. It probably means less safety, and it certainly means less patient satisfaction. It also means that the physicians are frustrated and unhappy as well. They don't like the level of care that they're given. In short, it's a dysfunctional delivery system, driven by all the wrong incentives. But changes are coming, and these are the essence of my new book, The Future of Healthcare Delivery, Why It Must Change, and How It Will Affect You.